hand over to our fantastic panel of speakers who'll go into more depth than all of these topics that I've just raised. So our first speaker tonight is Alison Treacher. She's a representative from Unite the Union, and also she's a joint secretary of the Care and Support Workers Organise. So please give Alison a warm welcome. Thank you.
Thanks very much, and thanks so much for the People's Assembly. Yesterday was incredible, a great show of strength, and it was great to be a part of it. So my name's Ali. I've worked in care for about 15 years. I've worked in care homes, supported accommodations, and in the community supporting disabled people. I work with some really courageous people trying our best in a broken system, a system which is underfunded, exploited by finance capital, outsourced and privatised, a system that leaves many of our community alone with their basic needs not being met, a system where profit is more important than people. I'd be doing a disservice to my colleagues if I didn't start by mentioning just how hard the pandemic has been for all of us. At the start of the pandemic, many of us were forced to work without adequate PPE. Some of us made our own PPE out of Polly Pockets and the elastic from their leggings. Others were issued substandard PPE, 4 years out of date, putting ourselves and those we support at risk. It's important to note that the battle in care is a gendered issue. The majority of care workers are working class women doing double shifts, returning from work after long hours to then care for our elderly parents, kids and neighbours. Throughout the pandemic, we were clapped and branded as heroes, but nothing has changed materially for care workers. In fact, things have got far worse for us. The decision in the Supreme Court on March the 19th, ruling that care workers were not working whilst on sleep shifts, came as a crushing blow. We were told that our labour, supporting disabled people in the community, being ready to react to crisis, being a shift worker, being disciplined if we left the workplace meant nothing at all. Our labour isn't even worth minimum wage. Proof that we as care workers cannot rely on the courts to make moral decisions. We have to fight for them ourselves. Whilst I'm incredibly pro-vaccine, I actually had my booster jab on Thursday, it's really important to highlight how care workers and support workers have felt bullied by government legislation around mandatory vaccinations. It's recently been reported between 40 and 70,000 workers will lose their jobs by the 16th of November with no financial remuneration. There are already over 112,000 vacancies in the sector, and this decision to pick on the most fragmented and unorganised workers will just exacerbate our already dire situation. In London, the vacancy rate stands at 9.5%. This is a rate where vital services are at risk of no longer being able to run effectively and forced burnout staff into even longer hours. Retention is a massive problem in our sector. Nearly 1 in 3 workers leaving within the first year of employment. In home care, it's nearly 1 in 2. Training is abysmal and career progression is non-existent. Those who've been working in the sector for over 5 years are on average paid just 15p more an hour than new entrants do. It's reported that care workers are leaving the sector to work in Amazon, which is because they feel the terms and conditions are better. This is the bleakness of the situation we face. Johnson's recent announcement tackling the crisis in social care does nothing to help us. For the first 3 years, the lion's share of money raised by national insurance hike will go into addressing the backlog in NHS appointments. So no immediate relief for services that are struggling to function and no pay rise for the 2/3 of workers who still do not receive the real living wage. The Centre of Health and Public Interest estimates that £1.5 billion leaks out of our social care system in private profit each year. The new levy will raise £1.4 billion annually for social care. Basically, the new levy will bolster the profits of shareholders whilst working people pay for that privilege. In fact, care workers will actually pay disproportionately more for the services that they provide on poverty wages. Something is seriously wrong here. We must fight for a national support service that works in parallel with the NHS, a service which is nationally funded and locally delivered, a service which is co-produced with service users, disabled people and workers within the sector, a service where independent living and the rights for those who are in receipt of support is central, a service where terms and conditions reflect the true value of our work, £15 an hour, career progression and a guaranteed minimum hours. But we have to do more than this. Care is not provided by a single service. True care is not something which is done to people. Care is fostered and organically supported in caring communities. We need caring communities supported by a care infrastructure which allows mutual aid and organic peer support to thrive, accessible public transport, free community space, and decent social housing. We cannot let the incredible work our communities did with the creation of thousands of peer support networks be forgotten. We, the working class, care for each other, each according to their ability and each according to their need. The task is large, but this is a fight for the world we want to live in, the fight of which we all deserve. Thanks.
Thanks very much, Alison. That was fantastic. Right, now I'm going to move over to our next speaker, Karen Reisman, a committed trade unionist who's been campaigning in the NHS for many, many years. It's a pleasure to have you here, Karen. Welcome.
Thank you very much, Helen, and thank you, Ali. And I certainly think that we in the health service sometimes feel like we haven't got the resources and the processes to deliver, but I think we are 10 times better off than the awful circumstances in which social care finds itself, where a large amount of social care needs, because they're not, you won't die from them, or you won't die in the next sort of soon, then you just not allowed any personal funding, and more of it is provided by people individually in their families and friends, or not at all. But I wanted to start not just with COVID, but actually pre-COVID. We had a banking crisis in 2007-8, and really since then we've had massive austerity across the public sector that has hit the health service incredibly hard. That we've had cuts in services, which meant that they closed 17,000 beds in the last 11 years. And it's because of those closures that it means we work in a health service now where you only need a tiny crisis, so you need a bad car crash on the motorway, and the whole of the health system locally goes into crisis and has no beds, and you have to move people, the ambulances, to go to other hospitals. So we were in that mess prior to COVID, where we weren't coping, and then we got COVID. So we got a whole number of people in additional, so we had crisis right across the system. And I do think a lot of that COVID was avoidable had they chosen to put people before profit, which they didn't. They consistently put everything in late, so that we got much more COVID than we needed to, and a lot more illness and a lot more death and a lot more tragedy for families up and down the country. But when they did that, our service ground to a halt in large numbers. And we have the horrific situation where both staff and patients were facing not having the right equipment, coming into hospital became a huge risk, but lots of people didn't get into hospital, and that was a huge risk as well. And I think the trauma of doing that, the exhaustion and the overwork that we as health workers have worked in. We had, as Helen said, 100,000 unfilled posts before COVID started, which meant nearly 1 in 11 health service staff are not there because they can't get anybody to fill the post. And that's been worse since they've been harder and harder on migrant workers, where the health service, which was built by migrant workers, which has been sustained by migrant workers, which has been one of the fantastic sort of multicultural sort of institutions that has reflected all that's great about the potential in the world has suddenly been made to feel like you're not welcome. And just the complication of visas, of having to, as a health worker, pay for you and your family a health premium in order to get in, is part of driving even more people away at the point when we need them. And I think we have to be clear that we welcome every migrant worker that's come here. You are more likely to be treated by a migrant worker than to be competing with them for a bed or a GP appointment. But I think they want to use migrants to scapegoat and blame the cuts that they've institutionally made over the last sort of 10, 11 years as a way of trying to divert attention from themselves. And I think that's an absolute disgrace. And I do think that when we had COVID and we had so many more patients come and we couldn't cope, I think that exhaustion and that overwork is not getting better. And we now have a system that is not delivering on a scale that is unimaginable. So I was talking to a paramedic the other day, and he said to me he'd been to 2 999 calls that day, both of which they had rung up 24 hours previously and been listed for an ambulance, and the ambulance, him, hadn't arrived until more than 24 hours, and they were left in agony. And he said it's not just soul-destroying to arrive at that house and to feel the anger and the frustration and the distress and the pain that people are under, but it is also distressing for you to watch it and to see that. And he said more and more health workers are driven away from the health service, not because we don't want to be health workers anymore, but you cannot cope with the level of distress that we're working into. I went to a community mental health team a few weeks ago. Every single person in the office that day was on antidepressants, and every single one of them said, we have cried once in the last week at least because of the pressures of the work that we're working under. And I think there's a limit to how long you can expect people to work in that way. And therefore it's not a surprise when then we get another pay cut, because by the time you take inflation and the national insurance cut and the cost of food and gas and electric and all the things that have gone up, when you get another pay cut, we have pay ballots right across the unions, regardless of which union you're in, which have higher results than we have ever had in National Health Service industrial action ballots, to say not only do we feel completely insulted by the 3% that you've given us. We put our lives on the line. We do 2 or 3 people's jobs every day we come into work, and you can't even be bothered to pay us a 3% pay rise. And I hear the Tories talking about truck drivers, and maybe the answer is that the employers should pay them more money and then they wouldn't have the shortages. Well, to be honest, if it applies to truck drivers, it applies to social care workers, and it applies to the health service. But the reason they don't do that is because truck drivers make money and social care and healthcare is a service. And I think increasingly they want to stop us being a service, and they want to turn us into the same sort of money-making process that you have in America. In America, you have the most expensive health service in the world, where if you've got money, you get healthcare that you don't need because you can pay for it and they can make money out of you. So you have unnecessary investigations, medications, operations, admissions, so that they can make money out of you. And if you do need healthcare but you're poor, you don't get the health service, and it costs 3 times the much as it costs here. That's the sort of system that we are moving towards if this government wants us to. More and more people are aware of it, and we have to fight to stop it now. The Health and Social Care Bill is one of the steps to get us there. That has to be opposed. And I think more people are realising it, but we have to be active and on the street. This government has to go, and the market and privatisation has to go from our care services.
Can you hear me? Oh, yeah. Yeah, thanks very much, Karen. I just want to draw out on a couple of the points you made there. I remember in terms of the shortage of ambulances, when I worked in A&E, there was an hour that you had to save a patient's life after a serious accident. We used to call it the golden hour. So these waits with ambulances, it literally is going to kill people. I just want to draw that point. And in the GMB trade union, we're moving for a legal ballot nationally on the pay question. Speaker, Pia Feig. Pia is from Keep Our NHS Public, which is an organisation that's very important to us. And we're delighted you're here, Pia, to think about how we can link up the work that goes on within the hospitals with the community campaigns. So welcome to the meeting, and thank you very much.
Well, hello everyone. Yes, my name is Pia, and I'm speaking on behalf of the local group, Greater Manchester group, of Keep Our NHS Public. And I would like to echo and reinforce what the other speakers have already said, that the workers in healthcare and social care are the heart of our service system. They're the heart of our welcome system. And that system is in crisis. And I talk as a campaigner and also as a user of those services. And somebody who wants to participate in my care, be part of my care, but get my care when I need it. And the major crisis that Karen has so aptly described, the workers in the healthcare system, in the NHS, experiencing and seeing, is one that all the people in this country who need healthcare, who need support to live in social care, are experiencing as well. And those people do not have a voice and cannot, in the moment, in any way change the crisis that they are experiencing in their health and care system. And the only measure that they can do is protest and try and change the decision makers who are casting their crisis into a rubble of a system. And if we're talking about a crisis, we're talking about hundreds of thousands of people who are suffering and can't get the support they need when they're ill, to prevent them getting ill, or when they need to move about in their everyday living that they can't do because they cannot get the support that they need to live. I'm talking about young people who are experiencing the first signs of mental illness and who could be prevented in getting support to have a well life and are condemned to a life of mental illness because they can't get an appointment for 10 months even to see the first person to help them in their in trying to counter their mental health condition. I'm talking about people who are experiencing extreme pain with hip joints and being able to walk, who are bedbound or housebound because they can't get a hip replacement operation for years. These are the reality, people living in pain, living in distress because of the crisis in the system. And we don't hear about them. We only hear about, well, even if to counter the criticism, we hear about waiting lists, but those are numbers that are massaged and don't reflect the great care, the great distress that people are living in at this moment. And we get a crisis of COVID, not perhaps a preventable crisis in the immediate term, but a crisis that led to 40,000 people dying in our care system of a preventable disease, in that those people were chucked out of our NHS without any infection control, chucked out, and without their consent. We never heard about whether the people who were in hospital gave their consent to being moved, nor their families. They were chucked out into the privatised care system, who also didn't want to take them, who also knew that there might be dangers, but they were given money, and the owners of the private care system accepted those people. They were given our money to be taken into the care system where they were being cared for without the infection control. And an epidemic, a lethal epidemic, spread in our care homes, spread by a decision of our government to massage the inadequacies of our care and system. And as some very clever person said, who I can't remember who it was, said, you never get a famine in a democracy. And that's what we got. We got an epidemic, we got a lethal epidemic in our care homes because they are not subject to people's control. They are not subject to the people who use them, their control, nor the people who benefit from them. And we are moving into a system about our NHS and our care system which is close to our hearts, which most people value above everything else that the state provides for us, but which we have and are increasingly getting no control on, and no control that we can see a system that's going into destitution, and we can only protest. And we have to protest harder, more consistently, and get rid of the decision makers who are plunging our NHS and care system into a lethal crisis for us all. And I'm talking particularly about the Health and Care Bill, which is presently being rushed through Parliament by this totally undemocratic government that wants to hide from us what they're doing. However, we haven't been aware enough about the dangers of this. And it poses a system that, even more than at present, but prescribed in law, a system of health and care that is solely driven by finance. That is the major issue that the Department of Health has to care for, that whatever care is provided has to be within the financial limits. So they've set up a system of allocation from the centre to various local boards. Like those local boards are boards of directors. And this is called an integrated care system. That is an integration of health and care at a local level. And they will set up a board of directors in Greater Manchester that will be on a Greater Manchester board level. That board of directors will be given an allocation of central government finance, and it will have to exist and it will have to provide services only as far as can fit into those financial constraints. On that strategic board will be only one elected member, one council representative for the whole of the 2 million residents of Greater Manchester. But that board of directors will have members of the NHS, of the management of the NHS, of the hospital and the community services, such as still exist, and of the private sector, who may be providing social care services and may be providing data services or may be provided computer services for the NHS. That will be the board of directors that will be giving a strategic lead to the whole of the health services in Greater Manchester. It will be set up like a private company board of directors. That is the national, that will be the national system. Now, there's lots of ways that people can fight for this, and I've been asked to wind up about this, but I would want to just say one other aspect that we, in Keep Our NHS Public, and we hope everybody will take up the system. That is, that our NHS is moving away from being a health for all system, and it's moving away particularly to make people who are migrants have to pay to receive care in this system, and migrants who live and have been living in this country for decades have to pay to use our NHS and for their children to use their NHS. And this is just the thin end of the wedge. And that is why we are saying that the fight for migrants to receive full care of our NHS and care services as the same as any other residents in this country is a fight for that we all have to take for health for all.
What we're going to do now is we're going to open it up to the floor for questions and contributions, because we want to hear about your personal stories of using the NHS and social care. And one of the issues with the NHS is that, people will miss it when it's gone. That's the problem we have, when we're campaigning for it. And, like the speakers have said, people are literally being replaced by systems and budgets, etc. So I think I saw a hand up there in the audience. Yes, Andy Hopping, CWU. Do you want to come in? Thank you.
Thank you, and it was great listening to that. Yesterday, when them people marched up 40 miles for care, I think it resonated on a lot of people that were at that demo that it's such an important thing. And I'm so pleased that the Greater Manchester have got their own group. My experience is my mum has got dementia. She's had it for now 12 years. She's living at home, and she had a seizure in January and was placed in hospital. I didn't have power of attorney over her medically. I don't think she needed to be in there more than a day, but she ended up being in there 11 weeks, and then they told me that they were transferring her for rehabilitation because she'd been in hospital for so long, and she ended up in a private care home, and they decided that that's the right place for her, not rehabilitation, because I said she could come home, and they wanted to place £1,000 a week for that care facility and against her house. She's worked hard all her life. She's paid all her taxes, national insurance, and they wanted to take that that off her house, the only thing that she's got. And I think it's an absolute disgrace. And the bit that really annoys me, I've managed to get her out now, and she's back at home. She's got all the stuff put in through a great social worker from the NHS. And my question is that would it be possible, why can't it be possible that we have nurses in the NHS? Why can't we have carers from the NHS? And they could be on the same decent standard of living. Why do we have to pay and exploit carers in this private system when they do such a valuable job in society? Thank you.
Thanks very much, Andy. Right, do we have anybody else who wants to? Yeah, the man in the blue...
Just general member of the public, my wife's a GP. I've gone through the similar to the gentleman there from CWU with my mother, dementia and so forth, so I can sympathise with him and empathise. Yesterday on the Mar Show, Boris Johnson spouting his usual high wage, high skilled society that he wants to move towards, which is a new phrase that's come up within the last 3 weeks that I'm aware of. What I want to ask is that do our unions, can we use that some way as an open door to fight for better conditions and terms? Because that's what our unions have been there for years and have no doubt been doing. Now, with that phrase, a high-skilled, high-economy workforce, surely, we can start to force the hand a little bit, or I'd like to think so. Again, I suspect it's just hot air out of his mouth, but let's hope so.
Thanks very much. I just quickly wanted to come in on the union question before I take, if that's okay, because obviously I organise in the NHS. And one of the things the unions have been pulled into quite heavily is the committees and the bargaining agenda, which is very important. But what's harder, and we don't see it as much as we should, is organising workers on the shop floor. And the answer is yes, absolutely. Unions do need to do that. We do need to engage our members, and we can get victories in the NHS when we do that properly. We've had lots of campaigns with the outsourced workers, for example, and there's a grassroots campaign now that GMB are working closely with called NHS Workers Say No. And again, we're trying to build basically for some action. We're going to do a legal ballot. A lot of nurses say, I don't think I can go on strike. I'm worried about the patients. However, there's Christmas Day cover for strike days in the NHS, and it's far better for workers to go on strike for a limited period than lose services for good. So that's the answer to that question. So I saw someone else indicate to come in, but I don't know if, Alison, if you wanted to come in on the social care question first that was raised by Andy.
Sure. So talking about, the comrade from the CWU raised some really interesting questions around why care workers shouldn't be in the NHS receiving the terms and conditions and the kind of agenda for change terms and conditions for workers. So what I would say to that is our government kind of put care as just elder people, just people who are suffering from dementia or need to be in a care home. However, social care is wider than that. Social care is for young, disabled people who want to access community services. Social care is for disabled people who want to go to the cinema because they shouldn't be housebound or locked in. So social care is a wide spectrum, and it makes it... The government, try to say, care is just for older people, but it's such a wide, broad sector. And so that's why, I advocate, and Care and Support Workers advocate for a national care service to work alongside the NHS, because not all care is medical. We have social needs. We're social creatures as people. And so, although I definitely agree there needs to be more care workers in the NHS, and those workers deserved good terms and conditions, but we also need a national care service, a national support care, an independent living service run and kind of guided by the principles of co-production with disabled people to, you know, offer a service which people want and people need, and it's wider than it's wider than care homes. So thanks. But thanks to the comrade for the CWU. Like I felt you. So keep up the fight, comrade.
Thanks very much. I can see somebody at the back indicating to come in, and then I'll bring you guys in.
Oh, okay. Hi. I set up a local campaign in East Sussex where I live, and one of the battles we always have is people understanding what's happening, and people's eyes tend to glaze over if you start prattling on about integrated care systems. And there's been so many policy changes, and it just my head in trying to work them all out. But I always use what lots of people say: we can't afford the NHS. That's one argument. Or if it was privatised, people's workplaces would pay, charities would offer healthcare. So there's just one story from my family, which I always use when I get this crap, to be honest. So excuse my language. My gran was, my dad and his sister had left home in the 1930s, and she was a nurse and a midwife and a war widow, and she developed breast cancer. And they said to her, okay, well, you're not going to be able to work, breast cancer. So she lost her job, and she then lost her access to healthcare. And then because she didn't have children living at home, she wasn't eligible for charity help. And so she went back to her home in Macclesfield, just down the road, and she ended up so distraught with no NHS and no social care that she gassed herself on a coal fire. And I'm afraid we need to remember stories like that, because, I mean, that debunks all the myths that bandied around. And I fear if we don't fight this, if we don't save the NHS, more women and men will be doing things like that. And I'm afraid I get really exhausted, and I got a picture up in my hallway of my gran, and she just got this look on her face. And when I come out of the office thinking, I can't do it anymore, she just like looks at me, and I thought, Christ, okay, I will. And actually I couldn't keep going without that photo. But that's my story. Personal stories, we need them. And actually, that means more than just me prattling on the doorstep to various people around my town about figures and integrated care systems and health. You know, they just get bored of me. So, anyway, thank you.
Thanks very much. So, do either of our speakers, you want to respond to a couple of those? Yeah, Pia's going to come in and respond.
Can you? Yeah. What I'd like to say is, yes, we've got to fight with the unions. There's a fight in the unions. But we've also got political representation locally. And it's overwhelmingly, in Greater Manchester, the Labour Party. And the Labour group in Greater Manchester appears to accept the level of funding and the level of funding for both the NHS and for care services that they fund. Surprisingly, they felt that Devo Mank gave them power, the devolution to Greater Manchester, and they have not opposed the changes that the government is bringing in under the health and care bill. In fact, we have been trying in our Keep Our NHS Public to contact councillors who were overwhelmingly Labour councillors, but any councillors in Greater Manchester who were willing to discuss with us about what the Health and Care Bill will do to our local services, to cut them even more than 10 years of Tory austerity. And they won't talk to us. They are all shutting their mouths and accepting the leadership of Manchester City Council Labour Party leadership in accepting the budget and accepting the lack of democracy and accepting the lack of say-so about our care, our healthcare and our care, and we can't find any councillors who will even raise their voice against these. So, can I just say, because we are looking, if you know councillors, if you know, whereas the local Labour MPs have objected and voted against the health and care bill, we need to take action to keep them strong against this bill. And at the back of the room, we've got a lot of publicity material and information about the campaign led by Keep Our NHS Public. Okay, but can I point you to a lot of things that you can do?
Thank you. Okay, I've got somebody with their hand up. Yeah, Dave, do you want to? Thank you.
Yeah, I just wanted to talk my experience of my daughter, who until very recently was an auxiliary nurse at John Radcliffe in Oxford, and she was on an intensive care unit before COVID happened. So she's been there on the front line for the whole of COVID up till last month. And I can see she's changed as a person, but she's determined to stay in nursing. She's resigned her position to go back to university to train as a full nurse. And she's determined to be a nurse. She's determined to offer care to people. And to describe her as a worker, like what I do a manual job, is not the same thing at all. These people on the front line in the NHS and in care systems are not just workers. They offer vital services to the whole of the communities. And they're holding the hands of the people we love dearly while they pass away, and sometimes in circumstances where these people are terrified. And what that does to their mental health, it must be crushing. So we need an NHS which supports workers in every aspect of their job. We need to pay for them a decent wage, and we need to pay for them to be trained. My daughter is self-financing herself for 3 years at university, so at the end of it she can come back to the NHS and give the job that she wants to give, and that's across the NHS. I love them, and they should get much, much better treatment.
Thanks so much for that. That was fantastic. Do we have any more comments, contributions? Anybody else want to say anything on this topic? I'm being pointed to somebody. Yeah, come in. Thank you.
Hello, everybody. I just want to tell you a long story short. Basically, I was diagnosed a month ago with terminal cancer, and I got 2 years to live. And I've been one of the lucky ones. The care here in this country, when you're lucky, could be the best in the world. But lucky is a word that should not be there. You should not be lucky to take care of your life. I grew up in the States, and I remember the 80s. We had a general hospital in San Francisco, and we had clinics where they took social care of people, homeless, people with mental illnesses, immigrants with no insurance. And came Reagan, and came the Republicans and the neoliberals, and they destroyed a country in 10 years. And I've seen that. And now I want to tell you, first of all, thank you to the good people of this country. But most important thing that I want to tell you guys is be real serious about this. I've seen it happen, and when it's late, it's too late. And I promise that if I get any better, I will accompany you or anybody else that decides to fight these monsters, because they are monsters. They murder our nation. And like I said, I am one of the lucky ones. Thank you, Salford Hospital. Thank you, the Christie. Thank you, the nurses. Thank you, Macmillan. I'm an immigrant, and I'm treated, first of all, as a human being. And that's the way it should be, because we are all immigrants, one time or the other in life. Thank you everybody here.
Thanks very much. Thank you. Thank you for sharing that. Now what I'm going to do, because we're sadly running out of time, I'm going to invite all of our panellists to come back in for about a minute just to sum up everything that we've heard today. So over to you, Karen.
Hiya. Thanks very much. Thanks to everybody who's made contributions. I'm sure it's not always easy to talk about your personal circumstances, and I think it can be a very brave thing to do. And I think you're right, in some ways people are lucky in this country, but I don't think our health service is the good health service that it can be. I think too often we do let people down and we don't deliver. We want to think it is, but it isn't. And I think it's deteriorated massively, and it will only be saved by people fighting. And one person asked about trade unions, and I do think we need to do more. We have had some strikes, but very few compared to the scale of the attacks that we've had. And the pay battle is one chance to overturn that, but we also need to do. In my trust, I know that there's a community mental health team that's balloted for strike action because they want to stretch an overworked team that work 5 days into a 7-day team, and they haven't even got enough staff to work the 5 days. And we need more of those sort of strikes, because every day we don't go on strike, we allow them to close more beds, to wreck more healthcare, and to kill more people, and to make us all miserable. And I think we know when we do go on strike. I've been on strike quite a bit in my life. Every single time I've been on strike, we've had massive public support from the members of the public, from other trade unions, and I think people should be more confident about taking action, not just over their own well-being, but the well-being of the people that we're supposed to care for, but haven't got the resources to be able to do so. And I think that we can win that battle, but we have to just encourage people to take more of it. And I think when we do, we need to give them full support, and then the next set of people will think, well, we can do that too, and we can win. In the private sector in the Northwest, there have been loads of strikes, over 10, where private companies have fought for equal pay with NHS. Every single one of those has won, and a larger number of them have then been brought in-house because it's not efficient when you pay people proper wages to make a profit as well. And I think, again, we need more of those, not less. We need to use the power that we have as workers, and that includes as health and social care workers, and not be bound by the guilt that you're letting people down for the one day that we're out on strike, because we are letting people down every single day when we don't go out on strike, because the Tories are getting away with murdering us and the population.
Now I'm going to go over to Alison to sum up. Thank you, Alison.
Thanks. And thanks for all the contributions from the floor. They were really, really, really powerful. And I think that, this is what, care, COVID has shown us that the most important thing is the care for each other, our neighbours, our families and each other. And this is why the struggle in social care and the struggle for our social, for the NHS is the most important. And every struggle, be it for housing, whatever, has to be framed through care. And we need to challenge a classist myth of unskilled work. Care is complicated. Responding to crisis is difficult. We are advocates, and my colleagues are skilled. And I will scream that. I was screaming that at Priti Patel yesterday. And it does change you, this work, because it just makes you recognise how important the people you work with are, and how precious we are, and how much we have to lose. So thanks, everyone.
Thanks very much. And last but not least, yourself, Pia.
Very much. I'm just going to say there are organisations outside of the community organisations that are fighting, and it requires all of us to do our bit at home or on the streets. And so please look at the materials that are there to help you. You could write to or pressurise your MP to make sure that your MP supports the positive amendments to the Health and Care Bill, but also that continues their opposition to the Health and Care Bill. Contact your councillor where you live. Ask them what they're doing about this crisis in health and care, because they will be the subject to responsibility for what's going on, although they'll try and deny it. So get in touch with them. There are specimen letters, there are petitions that you can sign, that you can do individually. Join the local campaigns. If you're not in a trade union, if you're retired or not working or whatever, join the local campaigns. Join Greater Manchester Keep Our NHS Public. Look at the websites of Keep Our NHS Public. Look at Reclaim Social Care Greater Manchester as well. We're a community group trying to support the workers and to try and protect the remnants of our services that we still have.
Thanks, everyone. I'm just going to ask, the meeting's finished now, but I'm going to ask if you please could make a donation to the People's Assembly. It costs a lot of money to put this event on, the cost of Marquee, electrics, placards. We've relied on a lot of free labour from really talented people to pull all of this together. So please, please, please make a donation. We've got the buckets at the back. We've got the two guys at the back, but also we've got a contactless machine as well. And we want to be able to come back and do this again next year and be able to draw everyone across the movement together, because we think that's really important. But we do need funding. It's so important. So thank you. Oh yeah, and you can donate online as well. There's a QR code.